So I am the Director of Digital Transformation and Communication at Parkinson's UK. It's a role I've been in for just under 6 months now, and I'm going to talk a little bit about what it is that we're trying to do, but particularly focused on digital health outcomes and work in that area. Parkinson's, there's a lot of medical research organisations in this room. You probably know more about Parkinson's than the average member of the public, but just to briefly talk about it, Parkinson's, it's not a fantastic diagnosis to get, but neither is it a death sentence. It's something that you can live with Parkinson's really well for a substantial period of time. I've met people recently who've been living with Parkinson's for 30, 40 years, and there's an awful lot that we can do to help people with Parkinson's live well with the condition, and it's a big area of work for us. We as a charity are focused on 2 broad areas. We want to find better treatments and a cure as fast as possible. This kind of message, a cure just can't wait. There hasn't been enough advancement in Parkinson's treatments in the last 50 years, and we're really trying some new things to change that picture. But we're also there for people living with Parkinson's today. Like most charities, we have a strategy. We are halfway through our current strategy, which talks very much about better treatments and a cure. It talks about helping people with Parkinson's take control of the condition, which covers everything from learning what kind of exercise can help them feel and live a lot better. It covers helping people feel like they're in control of their finances, the practical aspects of their life, and having a sense that they control their Parkinson's, not it controls them. And finally, we're really focused in our strategy on improving the standard, the quality that people get from their health professionals and the other professionals that they come into contact with, because I imagine, like many of the other conditions that are represented in this room, it's quite patchy. So that's just a little bit about us and what we're trying to do. The question here is about what role is technology playing in that. So we have a statement of kind of intent around this. We want to maximise the potential of digital technologies to improve the lives of people affected by Parkinson's. That is what my role is really about, but really this is more than, it's beyond just my role or my department. This is us as a charity. We're committed to making this happen. Well, what do we think that might look like? Well, we think it really is about 4 different areas. We think it's about helping us understand Parkinson's better. So Ashley just talked about the need to really harness patient data for digital health outcomes. We want to know what we can learn more about the condition itself and about people's personal experiences of it through data. We want to reach more people affected. Of course we want to do that, and the traditional channels that charities use, they get you so far. But are there further opportunities through digital technology to reach more people? Yes, I think there definitely are. We want to improve quality of life, and some of the things I'm going to show you on the next slides are partnerships and efforts we're making to see if we can do that through digital technology. So what's out there? What are the devices, apps, gadgets that could provide non-drug based treatments? Because we want to crack the drug picture here. We want to make sure that the medication that people are on is as effective as possible for as long as possible with as few side effects. But what if there are alternatives? What if there are devices that can help symptom management, side effect management without having to up the intake of medication? And then finally, we're also asking the question of how digital technology can make us more effective as a charity, and that is a lot of internal work, looking at our processes, looking at the skills of our staff, looking at really what it means to be a workforce in the digital era that we're living in. So those are kind of 4 big areas of work, and I'm going to focus on kind of those top 3 in my next few slides. So how are we starting to tackle this? Data-focused partnerships, really important to us. So we recognise that as a charity of the size that we are, so our income is in the kind of 30 to 40 million category, that makes us, I think, officially a medium to large size charity in the UK. There is only so much that we can achieve with the 400 or so staff that we have, even with our 3,500 volunteers. Data is an area that we are enthusiastic about, but I'm not sure I would say that we were experts in. So we need to find partnerships to help us develop, and I'm going to talk about a couple that we are in. So we have been in partnership with a company called Global Kinetics, who produce this device. It looks like a watch. It's called the kinetograph, or you might hear it referred to as the PKG. And what it does is a consultant neurologist talks to their patient with Parkinson's, and they decide it might be useful to understand a bit more about what's happening with the condition. The person with Parkinson's wears this device for a period of a few weeks, and what it does is it tracks a series of different things. It has an accelerometer, it has a whole series of different sensors feeding into it, and it tracks what we call on and off states. So on states are when your Parkinson's medication is working really well. Off states is when it's starting to wear off and the effects, it's not as effective for you. It's something that's very personal. It's not something that's that predictable. And typically people with Parkinson's spend a couple of years trying to get the right balance of medication for them personally. This device has started to make quite significant impact in the trials that have been done with it in the UK. So the quote at the bottom is from Dr. Camille Carroll, who's a consultant neurologist, Plymouth, and she said in the trial that she was doing using the PKG with her patients, it led to changes in medication regimes in 80% of patient cases. Now that is a pretty astonishing, and that's very much the case that's been seen in other trials with it. 80% of cases they've decided to change someone's medication regime as a result of what they've learned from using this device. What's going on there? Well, what Global Kinetics have found is that people are very bad at assessing when it's the medication wearing off versus their Parkinson's symptoms more generally. So they'll go to their consultant, and the consultant will say, well, how are you getting on with your medication? And they'll say, yeah, I think it's going okay. I mean, I have a sort of a period in the afternoon where I feel a lot more tired, but I think that's just because I'm more tired. And so the consultant takes that information they've been told and says, okay, well, you say you're getting on fine with your medication. What the PKG is showing us is that people aren't getting on fine with their medication, that their off states are often being prolonged by medication being at the wrong time, or the dosage being slightly wrong, or the wrong delivery method. And as a result of this data, 3 weeks it takes, and then a bit of data processing, we can make improvements in people's medication regime, which significantly improves their day-to-day life. It's quite a powerful tool, and yet really, really simple for the person with Parkinson's to use it. The PKG is something that's only available through some consultants. You can't just buy one. The data it produces at the moment is in a dashboard that's fairly impenetrable. We're also working with partners like uMotive, who produced an app that, amongst various other things, was used in a research study called 100 for Parkinson's. Not a medical research study, but it was a study to get people to track their Parkinson's day to day for 100 days and see on this kind of little scale what different things were happening at different times to build a kind of collective picture of people's Parkinson's experiences over that 100-day period. Again, partnerships like this for us are helping us understand the condition better. Now, I think some of these technologies are still relatively early stages. I think there's a little bit of nervousness about endorsing this kind of thing. We don't want to say to people with Parkinson's, you know, please do 100 for Parkinson's, you're going to feel lots better, because actually we don't know that they're going to feel lots better. They may feel no different. It may be that drawing attention to their symptoms on a daily basis actually makes them feel worse for a period of time. But we think it's interesting enough and low risk enough, and potentially taps into our kind of taking control strategic priority to give people access to these kind of things. And we're really looking at the burgeoning range of devices, apps and gadgets, and looking at how we can effectively support people to make good decisions without standing in that position of saying this is good or this is bad. Another thing we're looking at is clinical innovation and supporting clinical innovation where we see it. So we provide small support grants to clinicians wanting to do innovative things. We have a substantial network of healthcare professionals we call the UK Parkinson's Excellence Network. This is some of the leaders in those fields. We've got great coverage across the UK. So we're talking to them about how they feel about digital. And it's a really interesting split between maybe some of the old guard who are quite resistant to these ideas and don't particularly want to engage in these conversations, versus actually a whole new slew of the consultants and other healthcare practitioners we're working with who are really pro-digital and are kind of chomping at the bit to use more of these tools in their everyday practice. Plymouth, again, Camille, who gave that quote, who's been doing the trial with the PKG, they're trialling a really interesting new service. So traditionally with Parkinson's, you might see your consultant once or twice a year for the traditional almost no minutes. And people don't feel like they're necessarily getting the quality of care that they want. What Plymouth are trialling is a service where you get no automatic time with a consultant, but you get 4 appointments with a Parkinson's nurse throughout the year. People are also wearing the PKG device, or they're looking at other similar devices, and seeing a consultant is triggered on a needs basis. So you see your Parkinson's nurse, that gets great feedback. Parkinson's nurses know a lot more about Parkinson's than a lot of consultants do. So people feel like they're getting really good quality of care and advice. And then if the nurse spots something that requires further intervention, they'll refer you back to the consultant. Or if the device that you're wearing indicates a significant shift in how your Parkinson's is progressing, that also triggers a consultant appointment. Moving to a model where access to consultants is on a triggered, data-led needs basis, I think is a fascinating opportunity. I think it's definitely something that we'll start seeing more and more delivered through the health service. But I think there's a role for organisations like Parkinson's UK in helping shape that opportunity, in representing the person with Parkinson's in that, so that it's really, really working for them as part of a holistic service. And then the other thing that we're trying to do is just be really open-minded to this. I said that there's kind of an old guard in the health service potentially who are a bit resistant to this. There's also a bit of nervousness in traditional charitable organisations like ours. We've been around for a long time and we have a way of doing things, and it does work. It's really very successful, but it's only successful for some people in some ways, and we want to do more than that. So we're really trying to not put barriers up. We don't want to be gung-ho trying to jump on every bandwagon, but striking that balance is really important and something that we are talking about openly now in a way that I think we never were before. And that means letting ideas surprise us. So this device is a thing called Emma's Watch. It's literally called Emma's Watch because it was developed for a woman called Emma. I'm going to show you a video of it. If you saw a TV programme called The Big Life Fix that was on in, I think, maybe November, you will have already seen, this in action, but I'm going to show you a video which hopefully is going to work. No. Yes.
Right, I'm going to try and replicate this here. We're off to a great start. I tend to kind of just avoid doing sketching and writing now because it's not really worth it if you get something like that. Anything you could do that would just make my hand do what I want it to do and to be able to sign my name would be an incredible thing.
How do we even just begin to help her overcome this particular symptom of her tremors and helping her be able to regain her writing ability, her drawing ability? You know, I don't think we're ever going to get that back 100%. You know, my challenge is it's immense.
Someone's made a spoon. It actually counteracts the tremors you get from Parkinson's. So the spoon actually vibrates in opposition to how your hand might be shaking, and therefore it is steady.
I'm making a very rough prototype. And what this board does is I can connect into it through these wires, these tiny coin cell motors. So these motors will vibrate. Hello.
Hi, I'm Alison. It's affecting something. I don't quite know what's happening. Something is going on with it.
What this is doing is it's short-circuiting whatever feedback loop there is between the brain and the hand that's causing the tremors. I'm on to something, right? I'm on to something.
Woo. Woo. Jesus Christ.
Oh my God.
It makes me forget that I have a tremor. I haven't drawn one of them for a long time. I'm so casual about it. Yeah, I'm just going to draw a straight line. I've actually just written my name for like the first time in ages.
I can't believe it.
Mum, it's called the Emma.
Oh, brilliant.
It's got my name on it.
So, I mean, I think that video does a much better job than I can do speaking about the transformative effects of technology on a condition like Parkinson's. Now, we can't take any credit for that. That was, like, Emma's a good friend of the charity, and we work with her a lot because she's, amongst other things, she's a fantastic designer. But I think being open-minded to these kind of technologies, I'm talking to Kian, the designer, tomorrow about how we might be able to help the development of that as a product and whether it's appropriate for us to do that. And I think that's the question. If organisations like Parkinson's UK and charities like ours aren't going to get involved in this, who is going to? Because Kian works for Microsoft, but she did this as a one-off thing. It's not her job. Maybe the people at Google would love to help us with this. I would be very interested in that conversation. Commercial companies are not going to make enough profit out of most of these devices, unfortunately. So if they're not going to, who will? And I think the answer might need to be us. So hopefully that gives you a bit of a whistle-stop tour of what we're thinking and some of what we're already doing in the space around digital health. I'm very interested in conversations about partnerships, in ideas that you've got in your experiences, and particularly in the field of how we engaged for us, people with Parkinson's, for you, the different audiences you're trying to serve in this conversation, because I don't want it something that's led by the clinical community. Just to be completely frank, I think this, and what we see from the reaction to things like this is that people with Parkinson's are crying out to be involved in this stuff. So I'm interested in any or all conversations about those kinds of things. So, thanks very much.